A new W5 investigation is shining a light on a dark and potentially dangerous secret at Canadian hospitals. It's called drug diversion. It's what happens when doctors or nurses steal medication they're supposed to give to patients and use them to get high, sometimes while still on the job. Joining me with more is W5's Avery Haines. Good morning.
Good morning.
You know, we were talking a little bit about this before and during the break that if you think about it, of course this could be a problem, but nobody ever thinks about it.
You know, there's been such a big national conversation about the opioid crisis, the recognition that we are in the midst of a crisis in this country. And yet the conversation sort of seems to start and stop on the streets, as though somehow it's the junkie on the street that is the only one that's affected by this. There's no bias in addiction. It affects everybody in every profession, including nurses. And we spoke to one nurse who was struggling for years with addiction, who stole patients' drugs. And he told us it's like a kid in a candy store.
Yeah, let's take a look.
So you can really find diversion potential and diversion opportunity in most ORs, most ERs, most hospitals.
So this is laid out well before an operation actually gets played
Correct.
out?
Someone who's trying to divert the medication is going to have a syringe pre-filled with medication, and they'll come in a matter of 2 seconds, they're going to walk out the door. So it happens that quick. A little bit of diversion.
So this is a nurse who had a problem with drugs and got his job back, you said?
He got his job back. In the United States, there's a real recognition that diversion, which is a euphemistic term for stealing, right? I mean, that's the way they call it. But in the States, the DEA is involved in this. There are police forces in American states that are diversion forces. They go in and they track what's happening inside hospitals. He now runs a rehab facility for healthcare workers because it's a recognized silent epidemic, the healthcare industry and opioid addiction.
But, you know, we saw that these nurses can get very good at making that swap very quickly. And you're saying that in Canadian hospitals, the monitoring process probably hasn't kept up?
There's a real flaw in the system, and the diversion experts will say it's because hospitals don't want to acknowledge that it's a problem. They don't want to be making the 6 o'clock news with the fact that their nurses or doctors are diverting drugs. And so there's no proper monitoring, there's no proper reporting of the person who gets caught, and there's no national standard on what should happen if a nurse or a doctor is caught diverting. So some are sent to jail, some are stripped of their licenses, some are just quietly let go and they get a job somewhere else.
Look, drugs aren't in a hospital for the sake of being in the hospital. They're there for the patients. So what's at stake for the patients with this silent epidemic?
Well, you know, we have an interview with a woman who paid a pretty high price for a nurse's opioid addiction, and you'll see it on Saturday night at 7. The nurse injected a fentanyl that was meant for her. She was laying on the operating room table, about to go in for surgery. The nurse took the medication, injected it with her, and when she put it back on the table to be injected into this woman that we interviewed, she was given hepatitis C. Along with thousands of other people were exposed to hepatitis C, 36 other people got it, and she tells quite a harrowing story because she found out about diversion by getting such a potentially deadly disease.
Well, we've got another clip that we want to take a look at. You spoke to an addictions expert, Dr. Gary Veenman. He says this happens clear across the country. So let's take a look.
I think there's a significant problem of nurses having access to the opioids. I think every hospital should be watchful and monitor that.
But the regulatory bodies and the nurses associations are telling us there's not a problem here.
There is a problem all over Ontario.
And Canada.
And Canada.
And in the hospital.
And in the
Okay, so there is a problem. There are certain groups that don't want to acknowledge it. But do we have a sense of how big this problem is?
Well, no, and that's how can you solve something if you don't know what the scope of it is? You know, I went to Ottawa yesterday. For months, we've been trying to get the health minister to comment, on what does she make of this drug diversion issue and what does she plan to do about it? She refused our requests for interviews. So we had to go to Ottawa earlier this week to try to track her down. And the sense is that she doesn't really kind of get the fact that this is a potential problem and that steps need to be taken. Experts are saying there needs to be a national protocol on what happens because this isn't about vilifying nurses by any means. It's about getting them the help that they deserve. Doctors have a program. There's a national addiction program for doctors, and there isn't for nurses, and there should be.
Lastly, I'm all about best practices. Is there one jurisdiction or a province that's doing things well in this country?
I think that we look to the states as there are associations, anti-diversionary associations. There are programs that are set up for nurses. I think that Canada really is behind the States when it comes to helping nurses who are struggling with addiction.
Step one in fixing a problem is identifying that there is a problem. Thanks to W5 and to you for that great work.
Thank you so much.
All right. You can catch W5's Hospital Secrets this Saturday on CTV at 7 p.m. Eastern.